Hi, I'm Kathryn Shea, President and CEO of the Florida Center for Early Childhood. And we are bringing you today our very first webinar in our series that we are doing for May as a Children's Mental Health Awareness Month. And I'm delighted to be presenting the first topic to kind of launch us off. So thank you for joining us, and I'm going to begin our presentation on infant and early childhood mental health. So of course, this is infant mental health is near and dear to my heart. This is how I started my profession, actually almost 40 years ago, which is hard to believe. And my specialty area was in infant and early childhood mental health. And so that's been my passion and continues to be one of my passions of many of the services that we provide at the Florida Center. And so when I first started to learn about infant mental health, it was actually with a child psychiatrist. And I'm like, that makes me think about babies on couches, because that's kind of what you say when you think about mental health. And I think that might be sort of the first notion that folks conjure up in their brains when they hear the words infant mental health, because how can you possibly diagnose a baby, right? Well, you actually can. And we've come a really long way in understanding infant and early childhood mental health, and we know so much more than we did 40 years ago. So what is infant or early childhood mental health? Well, the best definition for me comes from the National Organization 0 to 3, and I strongly encourage you to go to their website. There is just an enormous amount of material and wonderful resources that you can learn to use more and to really get more in depth on the subject. So early childhood mental health is the social, emotional, and behavioral well-being of children, birth through 5, and their families. And we have to remember no child, no baby, no young child is in isolation, and including the developing capacity to experience, regulate, and express their emotions, form close, secure relationships, and explore the environment and learn. So that's what we're really looking at. That's what we're assessing and always monitoring in our infants and young children and their relationships with their families. So it's influenced by the physical characteristics of the young child. Every baby is born with their own temperament, and that's a sort of an innate quality of theirs that stays with them pretty much all of their life. Certainly the quality of the adult relationship in their life is extremely important. The caregiving environments the child is in, and then the community context in which the child and family lives, the culture that's surrounding them, and how their parents were raised certainly is an influence. So what we know is that relationships are critical for development. They have a lifelong, lasting impact on a child's ability to learn, their ability to connect with others and have sound, secure relationships. Even who they choose as an adult that they might want to marry all begins early in life. And that is formed and connected by the relationships they have with their parents and those around them. So supportive relationships are incredibly important, not only for physical survival, but for healthy social and emotional development. And relationships are really about how babies come to know the world. And they can only really learn about their world and the environment around them from the adults who are taking care of them. And so if that relationship with the parent is secure and protective and comforting, it really helps their brain to develop more secure coping mechanisms and to really build against stress and to be able to manage stress really throughout all of their life. And as we said, it's how they develop social emotional relationships and form connections, their play, their way to communicate, how they face challenges or don't face challenges is really embedded in those early relationships. And we always talk these days about kids not really having sometimes a sense of empathy or trust or conscience. And that really starts in early childhood. By the time a child is 5, they should really have all of those qualities of trusting and empathy, compassion for their fellow peers. Those should really be there by 5. And if they're not, something is missing in their social emotional development, and we have to go back and really work on that and capture it. We do know that there are a number of things that can impact development in infant mental health. Maternal depression is probably one of the biggest ones. We know that when moms are depressed, they have very flat affects or very depressed affects. And affect, the adult's affect, is really how the baby learns about feelings. So if that baby is looking at a depressed mom all day long, that baby is going to pick up on that depression and become depressed themselves. If the adult is emotionally unavailable to them, then that's certainly going to have an impact on their emotional development. If they cry for hours on end without being soothed or picked up or fed even physically, that's going to have an impact on their social emotional development. We know that domestic and community violence has a major impact on babies. Babies as young as 3 to 6 months, even if they are in their cribs, can have a stress impact and a trauma impact by listening to their parents fighting, or even looking and watching their parents fighting. We sometimes think it's not, babies won't remember it, or it's not going to have an impact. But we do know that it is a trauma impact for them that can have long-lasting effects. We also know that children who are in neglectful situations, that it not only affects their social emotional development, but it affects their brain development, and it affects what we call stress points in their brain. So they are much more susceptible to feeling stress more often, more frequently, and at higher intensity than those babies who were not exposed to circumstances of neglect or maltreatment. We know that poverty has a significant impact on the development of young children. And we know from the research of Deborah Phillips just the differences, the striking differences between low-income children from their better off peers. And we can actually begin to test babies with standardized test scores as young as 18 months to see that gap in development if a child is living in poverty. We also know that those childcare environments that babies are in and young children are in have a significant impact. If you look at some of this data here, look at 6 of 10 children are currently in some form of childcare. 78% of 4-year-olds, 84% of 5-year-olds, and 62% of moms of children are under 6 work outside the home. So these babies are spending time in childcare environments, and the quality of those childcare environments is really, really significant to the impact of the development of them, their brains, and their social emotional development. This is especially important and of great concern right now that babies are home primarily now with their caregivers, and they don't have the exposure of the quality childcare involved environment necessarily. And they don't have eyes on to make sure that they are being protected and that their needs are being met. So we do worry about our little ones that are not in our program right now. We check in with them and we have their great families, but that's a concern that I think we experience nationally right now. So, I've had so many people say to me, well, you can't diagnose a baby with a mental health diagnosis. Well, the reality is you can. And we use what's called the DC 0 to 3, that's the Diagnostic Classification for infants and children up to the age of 5. And it's really very similar to the DSM-4 for those of you who are familiar with that, DSM-5 now. And it has the same sort of axes that we see in the DSM-5, the axis 1. Axis 2 is the relational context. It's really the quality of the parent-child relationship. Axis 3, the physical health conditions. Axis 4, the psychosocial stressors. And axis 5, the developmental competence. So it's a little bit different, and you have to be skilled in knowing how to use it and how to make diagnoses in babies. And that is a very particular skill set, and you really need specialized training. A mental health therapist who just gets their license and graduates with their master's degree, they're really not ready to go out and do infant or early childhood mental health. You really have to do an extra amount of training and experience before you can say you're a qualified infant mental health therapist. So some things to consider when you're diagnosing, certainly the chronological, but also the developmental age of the child. You might be seeing a child who's 5 years of age, but developmentally they're only 3 years of age. So your expectations when you are looking at a diagnosis, your expectations have to be looking at them developmentally and not chronologically. We also have to take into effect, do they have developmental delays in language, in motor, in sensory and social emotional development, because those things will definitely have an impact. And then also family history of mental illness. We do know that there is a very strong genetic component in mental illness, and that babies who are born with parents, either parent with a mood disorder or an impulse control disorder, is much higher risk of also developing a mood disorder or an impulse disorder. So there are a number of therapeutic interventions, and way too many for me to get into any depth with, but I'm just going to name a few, and then you can certainly go on and Google and find out more for yourself what is of interest to you. There's parent-child interaction therapy, really designed for children 2 to 6 years of age who have externalizing behaviors. And those are behaviors of hitting, fighting, tantruming, and really having an incredibly difficult time getting along with others. The emphasis is to improve the parent-child relationship, and it has been found effective to also improve the child's behavior and help parents establish effective discipline. It's not appropriate in a number of cases, as you can see here, but where it is appropriate, it can be very, very an effective intervention. And then we have circle of security. I would say that's probably one that our therapists just use most of all. And it's a therapeutic intervention that's really focused on parent training. And it's really helping parents understand that their babies need a secure base, and that babies need to explore, but they also need to come back and touch base and feel that they are safe and that they're protected, and that that parent is there attending to their needs, their social emotional needs as well as their physical needs. And that baby, when they kind of wander away from their parent, they take that parent with them, and they know that that parent is there with them, and they check back, and they need to have that secure cycle of exploring and checking back and feeling safe in doing so. And then we have child-parent psychotherapy. That is one of the therapeutic modalities that we use most often at the Florida Center. It is an evidence-based dyadic therapy. It is done between the parents and caregivers and the child. And it really integrates a number of different theories, such as attachment and trauma and psychodynamic. It's really designed to restore the parent-child relationship, to repair the child's mental health and developmental progression, and to really help the parent and the child heal from past trauma. We sometimes are pretty amazed at the trauma that is still in many of our parents that has never been resolved, and it just gets displaced right onto the baby. So it's not just the healing in the baby we need to work on, it's the healing of the trauma in the parent to help that be a truly healthy parent-child relationship. And the parent-child interactions really are the focus of intervention. We know that there is a trajectory of child health and development from having a nurturing family, and we see the effects of poverty, maltreatment, the lack of health services, and toxic stress on development as children grow and develop. And all of those targeted supports, a nurturing family, pre-K quality childcare, and early intervention are really critical to impact any sort of negative things that might be occurring in the child's life to get them back to a healthy trajectory. And so we're going to go back to, it's all about relationships. We're going to kind of wrap this up where we started, and that the most important intervention with an infant or a young child is you, the caregiver, the parent. And we are the most important person in their lives. And remember, it only takes one really responsive relationship for a child to be okay. But those relationships have to be warm and responsive and characterized by what we call a high level of goodness of fit. So I hope that this webinar has been helpful to you today, and thank you so much for joining in. We are always available. My contact information is on the slide. If we can be of any help or support to you during this critical time of crisis or at any time, please don't reach out and to us, because we're here to help you. Thanks so much.